Okay, so we are live. Hi there.
So I got okay. Hi, happy Tuesday. Thank you so much for being our live today about the Equity Act and just wanting to welcome Delegate Price.
Hi.
Welcome, Delegate.
How are you all?
We're doing really well. We're here. Can you hear us okay?
Yeah.
Okay. I think your computer on anything else can you hear feedback.
No, nothing else is on.
Okay. So, you hear, that's okay.
I wonder if I should have it.
So, yeah, it's also a place to work on issues, but for the Virginia Advocacy Network, and we are here in Virginia. And we're here to talk about exciting, not just legislation, or yeah, we are amazing, bold, and brave original sponsors of this legislation, Delegate Marcia Price, here to talk with us about why she chose to sponsor this legislation, the importance of it. So yeah, just how are you doing today, Delegate Price? How are you feeling?
I'm well. I'm well, and just want to thank you all for the opportunity to continue this conversation. I am really encouraged as to where our Commonwealth can be headed in 2020 and what that means for people who need better access to reproductive health care and just justice, economic justice conversations, autonomy conversations, and all of the things that follow from that. So I'm really excited to be here today.
We're really happy to have you. We've been really eager to have this conversation with you, building up our work together in the legislative session this past January. How are you feeling? Are you recovered from the legislative session this year?
So, not sure if y'all have been watching the news, but I don't know this session ever really fully ended. And of
Right?
course, we are headed back July 9th. The way that my team and I run our office, we have not taken a break, but we will soon, hopefully. But we
Yeah.
feel good about the wonderful things that are going on in the 95th district and also across the Commonwealth.
Yes, yes. Thank you so much for that. Thank you for your hard work. We know that you all might be a part-time legislature, but reality, right? You do work
Right.
full time, getting out there talking to your constituents and to everybody statewide. So thank you for that. Okay, so let's get into the meat here of our discussion. I'm going to pass it to my colleague here, and maybe I'll introduce myself first. I don't know if I did that yet, but my name is Margie Castillo. I'm with the Virginia Latina Advocacy Network, and I'm going to pass it here to my colleague Carlota so she can tell us a little bit about the power of sharing our stories.
Hello, all. Welcome to this Facebook Live. As Margie said, I'm Carlota Arias. I am one of the field coordinators here at VA Land. And as you may know, we've worked with a broad base of Virginians. So we have, recently we have like so many activities, so many actions that we have throughout the year. And one of like this recent activities that we had was our IVE campaign. And why am I mentioning this? It's because we had the opportunity to share stories from our base. And this is one of the items that I actually would like to talk to you all. It's about the power of sharing stories from our base, like from our community. And this is exactly what, elected officials needs to know in order to actually support these kind of bills. So the power of these stories actually links to reality. Sometimes, elected officials are so busy that they forget to have this connection with our base. And this is like the bulk basically of our work, elected officials work, our work. And basically, what stories have, it's lessons, lessons of different kind of feelings and different kind of values, like hard work, efforts, like sacrifices, love, respect, empathy. This is like what basically uplift this kind of like stories. And we have like this particular one from one of our activists. And he recently, during our campaign, knocking doors, and he was just sharing, a story of his mom that recently got into this low income program to have accessible and low cost healthcare, program. And she recently had a mammogram, like after several years. So this is like so important to have like this connection. Actually, this happened to his mom, and I recently also, had. Some of you know that I have baby twins, and I had the opportunity to have Medicaid because at that moment I didn't have private insurance. So that allowed me to have, like a dignified motherhood, a dignified delivery. And this is something that people all need to know in order to like move forward with this kind of like bills.
Yeah. Thank you so much, Carlota, for sharing that. And so we, as VA LAN, we do this IVE work, which is integrated voter engagement, which means we're out on the doors talking to our community members year round. We're not just talking to them around election time, asking for their vote. We do that too, but we also talk to them before that to talk about the issues that are important to us. And one of those is this Reproductive Health Equity Act, right? And it gets at the point that Carlota was making just now, that it's not just about access to one thing. It's actually talking about access to a full spectrum of reproduction, right? Including family planning, including that prenatal care that Carlota talked about that made her feel like she had a dignified motherhood, right, coming into motherhood, including postpartum care, which is so important, right, with the rise of maternal mortality. I know, Delegate Price, you talk a lot about that. I don't know if you want to say more about that.
Well, I just did want to kind of double down on what Carlotta just said. It's just, I think when we presented and introduced the bill the first time, one of the most poignant pictures that I will carry with me is when, after I got done speaking, I turned around and there was a line all the way to the back of the room of people that were ready to speak to what I was saying. So as the elected representative, I can tell you the facts and I can tell you the stats that support this type of legislation. But when someone comes up and says, I need access to cancer screenings because here is my story, it makes that data come alive and it makes it real. And just to be honest, based on the composition of the current General Assembly, there are not a lot of people that we were talking to that know what it's like to get cervical cancer screenings because most of them were men, or to know what it's like to be judged based on your citizenship status, or to not have access to care because of the lack of dollars in your pocket. So hearing from people allowed for them to see, I'm not making it up. These are real live Virginians who are experiencing these issues. And so I just want to double down on the fact that sharing your stories matters, and it actually adds to the conversation to a point that it makes the legislation really come alive. And so that is the same case with maternal mortality when, you hear in my area, 1 in 4 African American women will experience significant complications during their pregnancy, if not die, between being pregnant, delivery, and a year up to after delivering their child. That is stark. But then you start hearing about women that have actually died, and those stories, like I said, just really make it come full circle. So we're not talking about concepts here. We're talking about real lives that can be impacted by legislation.
That's right. Real life people, right? And I think that's sort of, the impetus behind what we do here with our activists and our deep organizing. We're working with people to help tell their stories. Because I think a lot of times also we talk about people sharing their stories as if that's an easy thing. And it's actually really not. It takes a lot of bravery, a lot of leadership, a lot of boldness especially in a situation like the General Assembly, right, which is often a hostile environment for a lot of people that look like us, right? So, you know, being able to get up there and say things to these folks, sharing your personal story, takes a lot of work. So this team here did a lot of work to work with those activists, those line of people behind you, for them to feel comfortable enough to say those things to this group of people who have a lot of power, right? So I think I love what you said about bringing it to life, right? Giving it that lifeblood, because that's, you know, otherwise it's just words on a paper, right? And to see the people and the faces is a huge thing. Yeah. Do you want to say anything else on that?
I just want to just, you know, say that it shouldn't, I don't want to feel like I'm privileged to have, you know, health insurance.
Yeah.
That shouldn't be the feeling. That's just wrong. I mean, it's just, I just remember receiving this bill, around $56,000. If I didn't have insurance, I cannot imagine myself paying that bill now. It just doesn't come into my mind. I wouldn't be able to do it.
Right.
And I know this is the case of so many Virginians.
Yes.
And again, this is something that definitely touches directly. But also I know this story, it's not, you know, it's actually very common, unfortunately. And again, this should be the feeling of being privileged to have, you know, health insurance.
That's right. Especially because we know that, you know, things like large medical expenses, right, are an immediate precursor to poverty for some people, right? That's how people become, you know, entrenched in poverty sometimes, because they face a huge bill that they can't get out of. A lot of us are living with no savings, with no resources really to draw upon, right? And you add in, you know, this interference from anti-choice, anti-reproductive health politicians, and the vilification and stigma too, right, about reproductive health care. I think one thing that's interesting about this legislation is that we're not just talking about abortion access.
Right.
A lot of folks, when they hear the words reproductive health, right, they think abortion. And that is one really important part of it. But this bill is talking about the full spectrum, right? The experience that everyone goes through, whether, no matter how you identify, as a cis heterosexual woman, as a transgender person, however you may identify, you know, we all have experiences differently with reproductive health. And so that is what this bill is trying to get to, right? And I think that brings me to the problem, right? Is that, like Aruta said, thousands of Virginians lack coverage. We have things like Plan First, for example, right? That does exist to provide some free family planning services. But when you look at the, you know, requirements for something like that, you know, you have to be a citizen or a legal resident. You have to meet certain income guidelines that are pretty low and pretty hard to meet. And so it's great that it exists for some people, but that's a lot of folks that are still left out of the conversation. The ACA, for example, right, does not offer insurance coverage for undocumented folks or folks with DACA status. So there's a lot of people left out of the conversation, and this bill truly is visionary and trying to get at that problem, right? And we know it's going to take a long time. It's a battle. But yeah, I don't know what your thoughts are on that, Delegate Price.
Well, I think first to be having the conversation, for those of you that were in the room when we presented the bill, you'll notice that one of my colleagues from the dais, as I was talking about undocumented residents, used the term illegals. And that's the kind of toxicity that we're already facing when we just bring up the universal right to health care. You know, whatever your papers say, that doesn't mean that you deserve this or deserve that just because of a citizenship status. And, you know, the better health outcomes that we have for all Virginians, the better for our future, the better for our economy, the better for just our quality of life. And so to say that one person deserves it more than another based off where you may have been born is just absurd to me. And we're, especially when we're talking about, you know, this idea of, and I'm going to go there, this idea of being pro-life, but then you're not worried about the lives of people who look different from you. So if we're really going to embrace this idea of being pro-life, then it can't just be pro-white fetus. It has to be embracing people who need that spectrum of healthcare that you were discussing. And so that bravery is 100% true, and sharing of the stories from wherever you are on the spectrum of needing that reproductive health, your voice matters and your needs matter, and the rights to those, the access to those services matter.
Yeah, I think that's so right. And I think, like, you know, the story of our activist talking about his mother who was impacted, that's often not a story that you hear when we talk about reproductive health care, right? It's often always framed about abortion,
Right.
about young women having too many abortions. There's so
Right.
many myths and stigma around the issue. And it really ignores the full spectrum that we've been talking about, right? So for our activists to have had that moment to realize that what he was doing is a matter of reproductive justice is so powerful. And it's really the picture that we're trying to paint here, I think, too. Yeah. So I don't know if you had any other things that you want to say about kind of the problem that we're facing right now.
What do you mean?
Like, in terms of what this bill, will do and help those.
Well, from my experience, again, like with our base, it was just like with her, like so many stories, so many like personal experience facing different kind of like struggles related to health. And some of them are undocumented. And I'm really glad, the price that you mentioned, you know, how, we have to face these kind of like hostile environments when we deal with this. I mean, we are talking about people who are in a vulnerable, situation. And it's hard to, be out there and actually, knock doors, telling their story, going to Richmond, talk about like their struggles, their experiences, just, walking like long distances to probably go to a very like low cost, like there are not that many actually, health centers that actually can provide, these kind of like services because they lack of documentation. And it's something that we in this bill, this is a comprehensive bill. So this is like the importance to, to support this kind of like efforts as a community. I mean, we are all Virginians. It's not about like who has papers or who doesn't. It's about like who is actually contributing like to make this state, better and, humane. Let's just, keep focus on this part of like that we lack now because of, this era that we're living in. And this is something that I'll, be fighting for. I know like you have a lot of like supporters on this and, we'll keep on with this fight.
Yeah, that's right. And it's maybe a longer fight, but it's the interesting conversation now about why now, right? Why are we introducing this legislation now? Why did Delegate Price, take this bold leadership step in helping us introduce this bill? And I think, we're at a time where our state and national political landscape is changing rapidly, right? The future of Virginia is changing quickly. There may be opportunities upcoming soon for that to change really quickly and towards the favor of progressive policies. That will help our families and our communities. But there's also, increased restrictions that we're facing, right? We've seen the conversation on abortion bans, for example, happen states like Alabama, Georgia, so many others, right? We've had bans introduced here in Virginia in the past. So there's a national conversation happening, which I think for the reproductive health justice rights movement is really exciting because it's not often, right, that, my dad was talking about the bans to me the other day, and that's not a conversation we typically have. So, I think that was really exciting to see it kind of percolating among so many people. And it's a moment to take advantage and say, hey, yes, it's about the bans, but also we don't want to just keep fighting against bans, right? We also want to actually do proactive work. We want to be out there like winning things and, expanding coverage for people, not just defending what we have, right? So yeah, I mean, I think Delegate Price, it would be really great to hear from you. Like right now, what was the impetus for you to show your support here and take this leadership step?
Yeah, so I mean, under this current federal administration, a lot of rights are under attack. And so I think one of the first pieces of the legislation is that it codifies the right to an abortion here in Virginia. And so if Roe v. Wade were to fall, most scholars are saying that it would kick it to states' rights. So making sure that Virginians have the access that they constitutionally have now to legal, safe abortion. And just a note on that, like banning abortion doesn't ban abortion, it bans safe abortions. And so just want to uplift that. And we can't go back to the days of secret, clinics that weren't safe, and just making sure that the access for those that need it is there in a safe way. And then also the piece of inclusive language to make sure that no matter how one identifies, if they need medical coverage, whether they check male, female, or other, because those are the three categories that we have, it just allows for someone to get the coverage that they need, no matter the terminology that they are using, and it does not. It prevents insurance companies from discriminating in care. So if there's someone that needs the care, they should be able to get it, especially if they're paying for the insurance. Private insurances, like if you have my copay, you have my money, you have my premium, then I should have care. And so then the
Okay, well, hi folks. For those of you who are just tuning back in or just rejoining, we had some technical difficulties, so we had to restart the live. I think we're just going to wait another minute for Delegate Price to join us again, and then we can continue with our fabulous conversation about RHEA.
I'm back.
So I feel like we were really getting into the thick of, you were talking about in terms of access, and I think why it was really important for you to sponsor this bill in particular. Sorry that the call dropped a bit, but
No, you're fine.
else that you wanted to share on that topic.
Yeah, I just wanted to say currently, as we're talking about why it's important at this time as well, just wanted to uplift that if there is an undocumented person that needs the benefits, there are restrictions on Medicaid. So for one, you either have to be already pregnant, which we know that doesn't include the full spectrum, especially if we're talking about contraception. That's a little late there. But these other services that, the cancer screenings, mammograms, they're not covered. It's just for the pregnancy services. The other is you have to have been working for 10 years. And so I think about if you get your first job at 18, to not have reproductive health care benefits until you're 28, that's the majority of your, potentially childbearing or, whatever years that you went without coverage and without services. And so that's what we're really talking about when we say access and equity, removing the barriers to make access and equity realities and not just words. And just in the political moment that we're in since February, equity has been a buzzword that people have been using about, trying to really excavate the places in our code where things are inequitable. And I think whether it's race or citizenship status or gender identity, we have to really look at how reproductive health is handled within our code. And so that's why the Reproductive Health Equity Act is so timely and so important for this political time to get rid of inequities within our own autonomy over our bodies. I think is the most foundational and fundamental inequity that we could work on.
No, thank you so much for that. And I know all of us here over at VA Lawn and so many of our activists really thank you so sincerely for your leadership on this. Because as we strive to have a more equitable Virginia, a more equitable United States, we know that we as a community organization also really need to work in partnership with elected officials like you.
Awesome.
And your excitement and your eagerness to really take this head on is, I think what's really going to make this a reality for us. I think because it is, for me at least, not every day occurrence, I have the chance to speak with an elected official like this. And so, you had touched on an experience that we had when we were in line waiting to give our testimonies, when you started to get grilled a little bit by some members of the committee. So, what was that like, or how do you keep your cool when you know that you're putting forward a piece of legislation that is going to help so many people, and you're hearing opposition, whether it makes sense or it doesn't make sense? How do you kind of like keep your cool or stay motivated when you are face to face with opposition?
Yeah, I mean, that's a really good question. And I think that it's an everyday feet to try and remain calm, especially when some of the different disagreements that we're having, they're not regionally based, they're not economic, they are true whether or not you respect me or my village that was behind me as human beings. And so it's tough to have a let's agree to disagree type attitude when we're talking about my humanity. I will not be able to compromise on the fact that I am fully human and I need to be respected as such within the code. So when terms are used in a derogatory way, or when questions are asked to try and trip me up or anything, I think focusing exactly on what you said, on the thousands of lives that could be positively impacted by this legislation is what keeps me grounded. But then also knowing that I am literally standing on the shoulders of those that have been fighting this fight before me, and also standing beside those of you that had the courage to come up and speak. It makes it easier than if I was just standing there by myself. I don't always keep my face in check. I don't always keep my tone in check. I have been known to kind of let a few fireworks come out, but that's what's needed. I think honestly, we cannot take this lying down. It is a fight, and so I came prepared for such. But I'm always going to be respectful and have that dialogue as a legislator should. But it does take, I think, practice and healthy outlets and vices for the frustration, but then also managing expectations. I knew what the room looked like when I was walking into it, and I knew that this year was a first step towards a long and arduous process, but I also know that that's what motivates me to get more like-minded people into the rooms where the committees meet so that we can have more favorable votes.
Absolutely.
Can definitely relate to those feelings. I think it's every like the organizers like facing these struggles and these like hostile environments around our community. It's just like a matter of just thinking about like those stories that I mentioned before and always keep them in our heads. Just like remembering like this is what we are fighting for. We are fighting like for this humane process that you just as you're sponsoring this bill. And I'm really glad that you mentioned, because sometimes I know some elected officials just, I don't know, uplift other kind of like values. And this is about like, we're talking about human beings, as you just mentioned. And it's so important to, again, to humanize struggle because
Right.
about like community, like members of our community. We're just, it's something that it's hard. Definitely, it's very complex to have ourselves like in a very calm way to able to argue and fight for this kind of like this. But you just showed back in Richmond. I remember I was just coming back from a maternity leave, and I was just like so touched, and I was so like impacted by like all the efforts that are being done for this bill.
Yeah, it's definitely a team effort between you all and Progress Virginia, and just people coming, to the table and understanding that oftentimes when I'm speaking on behalf of voices that are otherwise muted or suppressed because of systemic forces. So, the mother that needs to speak up but is working her third job and can't get to Richmond, it's really important that I maintain my composure so that her story can be told, so that her voice can be in the room. So whether it is fighting against criminalizing the impoverished, or whether it is fighting for those that identify in different ways than what some other legislators think that they should, as far as gender identity or sexual orientation, or whether it's fighting for those that are undocumented but are meaningful members of our society, those are fights that I'm willing to take on because of partners like yourself.
Thank you. I think, as you mentioned, the partnership aspect is what's so important, because we could go up and testify, our allies at Progress Virginia or similar organizations can all, share stories. But I think what really had such an impact, in my opinion, when we were in the committee hearings was that we were able to bring folks to stand in line to testify. And I know the night before we drove down about an hour and a half, 2 hour drive to Richmond from our office here in Virginia, Northern Virginia. And we stayed up, and it reminded me of those nights in college when I'd pull
Yeah.
working on our testimony, practicing, making sure that people felt comfortable and that they were uplifting the realities of what they or their families or their friends have had to go through. And I thought what was so beautiful is we were able to present a really big range. I know I personally talked about how a bill like the Reproductive Health Equity Act would allow for cervical cancer screenings. And we know that Latinas have some of the highest rates of cervical cancer, and that's not because they're more likely to get sick, they're more likely to be uninsured and not have
Right.
to that care. And so, you know, as we all went through, and I know there was so much excitement and buzzing as we were waiting in line, and there were moments where I felt a little intimidated. I'm gonna be honest. It was a little intimidating, but to know that Delegate Price and our friends with other organizations like Progress Virginia had our backs to make sure that our folks were going to be able to share their stories and be respected made all the difference. And, you know, also kind of what Margie was saying before, that it's so exciting to also be able to put forward proactive work and to be able
Absolutely.
to, this bill matters to me because it's my vision for reproductive justice in Virginia. And so that I know was just such an incredible experience. I don't know if Carlota or Delegate Price, you had other experiences with that, but I know that's something that I'm definitely going to remember for a long time.
Yeah, I would say ditto.
Yeah.
I'm trying to remember, like, you know, every minute of the session, just like the feelings or like these scenes, as we say, just like all the prep, all the effort. Again, it's just so worth to uplift, you know, like every step that was taken to get there. Just, you know, probably, you know, taking a day off from work, from school, you know, some of them like, you know, like some of them like take care of their sisters or like little brothers, and they you know, they always go beyond, you know, what they can just for the community, not only like for their families, but it's just like I know they work hard for the community, and I was just, you know, very glad to, you know, remember those moments because it's definitely gonna make a difference, and it shows like
Yeah.
how actually unite and in order like to move forward and move together.
Mm-hmm. Yeah. Thank you so much for sharing that. It definitely brings back really good memories. That helps us continue through and continue to engage with our legislators as we hit the summer months. I think now we might transition and take a couple questions that we had on the Facebook Live. So let's see what questions we have.
How can folks get involved in fighting for the Reproductive Health Equity Act over the summer?
Oh,
Good question.
well, I can start, and then if Delegate Price has anything to add. So for us, we think that this is a great time to visit your legislators. I know one of my legislators lives the neighborhood over. I'm not suggesting that you go to their house. However, they're around. They want to meet for coffee. This is a great time to talk informally. If you're really interested, we have excellent tools that we can provide you. Talk about the Reproductive Equity Act. Or if maybe an in-person meeting doesn't work, you can still reach out and help you write a letter that we can either use in the future for a testimony. You can send directly to your elected official. But from the legislative side, I don't know if there are really other little tips or that you would recommend.
Yeah, absolutely. I think this is a perfect time, especially as we're looking at those other states that are dealing with trying to fight bans. This is something like we said is proactive. So if you know that your legislator is pro-choice, then you can call them and tell them that you would love to see their name listed as a co-patron of this bill. If your current legislator is anti-choice, then you can make this a campaign issue because all 100 delegates seats and all 40 Senate seats are going to be on the ballot in November. And I would, you know, just say that what the people make a campaign issue is what becomes a campaign issue. So make sure that you are raising your voice loudly as to what it is that you would like to see in your representative as it pertains to not just fighting against the bans, like we said, but proactive work on equity within the reproductive health sphere. And really and truly, those stories mean a lot. I read, and my team, we read emails, we answer phone calls, we have, office hours. Come to our town halls. If someone has an event, show up, because that is an opportunity for your voice to be heard. This is supposed to, I say this all the time, this is supposed to be representative government. If I as a legislator do not hear from the people that I represent, then that chain is broken. And so it's really incumbent upon you all to speak to us and for us to listen. So it's got to be a dialogue in order for it to work.
Thank you so much.
Also, as a community-based organization, have different kind of like events, well, not only this summer, throughout the year. And we are always trying to, as Delegate Price said, to know more about those stories, to know more about those struggles. And that's what we have, these safe spaces to have that conversation. Sometimes, you probably don't feel that you're ready to, specific, but that's why we are here, like for Virginia as well. We're always like collaborating with each other in order to provide this information, to provide safe spaces, to have these kind of conversations with our community.
Mm-hmm. Yeah, and as we wrap up this Facebook Live, we just really wanted to thank Delegate Price once again for taking the time to participate here with us. Carlota mentioned in particular, finding safe spaces, creating safe spaces to have these kinds of conversations. And maybe you live in a community where you don't really know the community organizations that are there around you. And so we really invite you to come and reach out to us, whether that's on Facebook or over email, so that we can help start these conversations. Maybe you've never shared your story before, and it can be really intimidating, and we want this to be, a representative and a participatory process where we can all engage and make sure that all of our voices are heard. But definitely be on the lookout on our Facebook pages for any updates on this campaign, but we're so excited to see what we're able to build together. But Delegate Price, I don't know if you had any final words as we wrap up.
Yeah, I would just encourage anyone. I'm on Facebook, Instagram, Twitter. I don't have to be your delegate to take your voice seriously. This is a piece of legislation that will have far-reaching impact throughout the Commonwealth. So you can feel free to reach out to me as well, especially if you have any questions or if you need clarification or if you want to have your story included in the bill presentation for 2020.
Awesome. Well, thank you again and hope to speak soon. Bye.
Awesome. Bye.